Agenda item number 5 is the award of Centers for Disease Control and Prevention Community Transformation Grant, an update on CDC Communities Putting Prevention to Work grant. Dr. Huang, I thought I saw him here. There he is. I'm not sure it's on. Can you tap the little base, touch the base of the microphone?
And the slides? Okay, here we go. Good afternoon. Appreciate the opportunity to give you an update on what we've been doing with the Communities Putting Prevention to Work grant, as well as our new Community Transformation grant. Just starting out, we've talked about some of these data before. If you look at the data from Travis County, cancer is the #1 killer. Heart disease is second. Fourth is stroke, and chronic lung disease is fifth. So about 4 of the top 5 are related to tobacco use. Translate that down. This is actually Texas data, but it's about over 24,000 deaths due to tobacco each year in the state. We estimate almost 600 in Travis County. And I also put on this slide because it also shows obesity, and these are the preventable causes of death and in our state. So it's tobacco, obesity, the top ones. But again, we always say tobacco kills more than AIDS, crack, heroin, cocaine, alcohol, car accidents, fire, murder, and suicide combined, and it's entirely preventable. So with our Communities Putting Prevention to Work, I know we've briefed you in the past about that grant. We had a lot of success in the last year and a half, and you think back to where we were a year and a half ago and where we are now. Some of the key targets that we've been working on are in the healthcare settings, schools and university, media, work sites, and community. And I'll talk about some specific areas where policies have already been implemented. But for instance, in healthcare, we've been working with the ICC, formerly the Indigent Care Collaboration, or Indigent Care Collaborative, now I think Integrated Care Collaboration, but it's all the indigent care providers in the community have been, and also Seton, have been working on electronic health care record changes, system changes to all of these settings so that every patient who comes through their clinics is assessed for their tobacco use status and referred to the cessation resources. We funded Seton so that there's a community cessation resource that's available to anyone in the community for free. They can even get free nicotine replacement. We've worked with schools and universities. Houston-Tillotson adopted an entirely tobacco-free campus policy. ACC just announced that they're going entirely smoke-free effective in January of this coming year. We've had a lot of other work going on. I know there's efforts at University of Texas, other universities and schools in the community. We've had a lot of media campaign that's sort of reflecting the messages that I've already been talking about, the high burden of tobacco-related disease in our community. We've been working with work sites, the Mayor's Fitness Council, working on, again, promoting these tobacco-free campus policies because we know they're very effective. For instance, Dell Computer has shared with other employers that, as a result of their tobacco-free campus policy and offering cessation services, their smoking rates among their employees went down from 13% down to 3%. Austin Travis County Integral Care, another work site where with the population they serve, very difficult to adopt these policies, but they've been successful, and their own staff rates of smoking have dropped from 29% down to 13.9%. So very, successful, and the people really like it. Dell has shared that you can expect it's noisy for the first couple months, but after they're implemented, they started getting emails from the people who had been most vocally opposed to the policy saying, I wound up quitting smoking and it, quote, changed my life. Thank you for doing this. So again, a lot of successes in those areas. With community, we're getting a lot of policies. I know the Capital Metro Transportation Board just adopted tobacco-free bus stops last week. We hope that there might be some more teeth put into that so it can be enforced even further. I know that the parks is coming up next month, that the parks are going to be proposed to be smoke-free. They already actually have been smoke-free for the last several months with the burn ban and that being a permanent thing. So again, a lot of community changes, social norm changes that really help protect the public in our community from secondhand smoke and tobacco. Again, these are just some of the policies that have been already adopted in our community as a result of CPPW. So tremendous success with this program. And the success of CPBW has really positioned us well to implement the community transformation grants. And so the community transformation grant program, it is authorized under the Patient Protection and Affordable Care Act, known as the Healthcare Reform Bill, and its really purpose was to create healthier communities by building capacity to implement evidence and other practice-based policy, environmental, programmatic, and infrastructure changes, and supporting implementation of interventions in 5 strategic directions. And so it builds on what we've done with CPBW on tobacco-free living, but also then is expanding it to active living, so physical activity and healthy eating, and high-impact evidence-based clinical and other preventive services to address hypertension and high cholesterol, social and emotional wellness, and healthy and safe physical environment. But the guiding principles of this are to maximize the health impact through prevention, to improve health equity, and then also to use and expand the evidence base for local policy, environmental, and infrastructure changes that improve health. And I want to just, when we talk about the policy, environmental, and infrastructure changes, what we're talking about, and the reason they're focused on that, and I think it's a great focus, is because it's to overcome, quote, the stickiness problem. And what we talk about with the stickiness problem is, for instance, this is a study that was in JAMA looking at exercise participation. And so they looked at trying to get people to exercise more by long bouts of exercise, short bouts, or short bouts in home treadmills. And you can see during the first 6 months, there was good, all the 3 arms of the study showed increases in exercise participation. But what do you think happened after those first 6 months? Does it go up? Does it stay the same? Does it go down? It goes down, you know? And you see that in other studies. Here was a self-help versus commercial weight loss programs. And again, the self-help and commercial weight loss, both during the first 6 months, they show effectiveness. But then what happens as time goes on? It goes back to the norm. And so by focusing on the policy system environmental changes, then it creates the change in the social environment that has the long-term impact on these behaviors. And that's where, again, with tobacco, the policies and changing the social norm of our community are very effective. And the same sort of application to physical activity, nutrition, and obesity. So this is a slide from Dr. Tom Frieden, the director of the CDC, showing the factors that affect health. At the base of this pyramid are the socioeconomic factors. Poverty, education, housing, inequality are the things that are the foundation for affecting health. Then as you go up the pyramid, changing the context to make an individual's fault decisions healthy. And we talk about making the healthy choice the easy choice. So again, it's like smoke-free laws, tobacco taxes, trans fat and sodium reduction. Then you move up and long-lasting protective interventions such as immunizations, brief interventions, or cessation treatment, or colonoscopies. You keep moving up this pyramid, then you get to clinical interventions like treatment for high blood pressure, high cholesterol, diabetes. And at the very top are some of the traditional things that we've done, just health community counseling and education, telling people to eat healthy and be physically active. But again, if you can change the things further at the base of the pyramid, that's what has the longer-term effect. And it also has the largest impact as you go down the pyramid. So these are some of the things and this is actually a CDC slide for a community transformation grant, showing the type of things what states and communities can do to prevent obesity. And these are the exact type of things that we proposed in our proposal to the community transformation grants. And so with schools and child care, you can see sort of doing increasing exercise and physical activity in the classes, reducing screen time, increasing walking and cycling to school, at work sites, work site wellness programs, in communities, increasing access to healthier food, eliminating healthy food deserts, in healthcare, BMI measurement, making system changes in the healthcare setting like we've already done with tobacco. So every patient is systematically addressed for one of these problems and followed up. And so with our community transformation grant, out of 244 applications, we were one of 35 communities selected for implementation level funding, and that's the higher level funding. There were an additional 26 communities funded to receive just smaller level capacity building funds. We're receiving a little over $1 million for year one. It's a budget of a 5-year grant program, but it is important to note that years 2 through 5 are dependent on the continuation of funding for the Affordable Care Act. And so some of the types of things, again, that we proposed, incorporating into the city's 30-year comprehensive plan, the Imagine Austin plan, to develop and implement a healthy Austin code, And so as the street design, incorporating that it promotes bicycle use or wide sidewalks and physical activity and connectedness to the parks and to the transportation systems, all these things to promote physical activity just being the way people get around in our community. Increasing the number of neighborhoods in Austin that have access to grocery stores or markets selling high-quality fresh fruits and vegetables. Promotion of urban farms, community gardens, things like that. Promotion of tobacco-free living and protection from secondhand smoke. Increasing the availability of healthy foods sold or used by restaurants, schools, work sites, healthcare facilities. And then clinical system changes, again, like we've been doing with some of the ICC providers to change and improve outcomes related to high blood pressure and high cholesterol. But again, the same partners that we've been working on with CPPW were well positioned to then expand those interventions and the type of strategies to address physical activity, obesity, and hypertension and cholesterol. So that's it for the update on that. Again, we're very pleased and fortunate to get this. I want to also build on some of the things that Councilmember Morrison's been doing with obesity and the obesity strategic plan that we have for a community. But it's a great opportunity.